Huh? Yeah, sorry.
So, good evening, everyone. Welcome to the Voice of Healthcare and UN Global Compact Network, India's third edition of Universal Health Coverage virtual event. This session will focus on the critical topic of multi-sectoral partnership for achieving universal health coverage. We are happy to have you all as a distinguished panel of experts who bring a wealth of knowledge and diverse perspective to this panel discussion. We have Mr. Rajiv Nath, Managing Director, Hindustan Syringe and Medical Devices, and Forum Coordinator of AIMED, Dr. Sandeep Mengi, Managing Director, Maharshi Dayanand Hospital, Dr. Shilpa Tatke, Group CEO, Jupiter Hospital, Mr. Harshit Jain, General Manager, Business Development, Panacea Biotech. To lead this session, it is my honor to introduce our moderator, Dr. Somnath Singh, Deputy Director, UN Global Compact Network India. Thank you all for joining us. Dr. Singh, I will now hand over the session to you. So please take the session, sir.
Thank you very much, Ravinder, and thank you very much, Voice of Healthcare, to collaborate with UN Global Compact Network India for this third edition of Universal Health Coverage Day. Good evening, ladies and gentlemen. It gives me great pleasure to welcome you all to Voice of Healthcare and UN Global Compact Network India's third International Universal Health Coverage Day, supported by Association of Healthcare Providers India and the Association of Indian Manufacturers of Medical Devices. Today's session themed multi-sectoral partnership for achieving universal health coverage aims to bring together diverse stakeholders to discuss collaborative pathways to ensure equitable, resilient, and accessible healthcare for all. As we mark International Universal Health Coverage Day, it is an opportune moment to reflect on the importance of universal health coverage as a cornerstone for achieving Sustainable Development Goal 3, which talks about good health and well-being, ensuring healthy lives and promoting well-being for all. The global call for universal health coverage is clear. Healthcare should not only be right about a shared responsibility across sectors. Here, I would like to take some moments to introduce my organization briefly. The UN Global Compact Network India, established in 2003, is the Indian arm of the world's largest corporate sustainability initiative. It serves as a platform for businesses, civil society, and the public sector to align their practices with the 10 universal principle of the United Nations Global Compact, spanning human rights, labor, environment, and anti-corruption, including sustainable development goals. So, about this session and the speakers, I would like to just mention that this session is particularly significant as it emphasizes the role of multi-sectors partnership in achieving universal health coverage. Collaboration across healthcare, finance, education, and social welfare sector can unlock innovation, strengthen infrastructure, and enhance access for underserved population. We are privileged to have with us an esteemed panel of speakers who are pioneers in their respective fields. So, to begin with, I would like to invite Mr. Rajiv Nath, the Managing Director, Hindustan Syringes and Medical Devices Limited. Dr. Rajiv Nath, in your experience, how do multi-sector partnership contribute to achieving universal health coverage, particularly in enhancing accessibility and affordability of healthcare? Your insights and your sharing will definitely enrich the participants on this particular topic. Over to you, sir.
Thank you, Dr. Somnath, and thank you, VOH, for organizing this discussion.
which I think is very, very relevant as an ongoing review exercise. Uh, in the area of public healthcare, drug delivery or medical devices used in public healthcare, there are many challenges. It's like red lights. You cannot just go around marketing red lights. It's not like selling branded, say, insulin syringes. So there has to be a public healthcare need for it. It's normally pull driven. So if there's an issue, for example, like unsafe healthcare from unsafe injections, and that leads to disease burden being increased, because whether it's through immunization, where syringes were being reused, whether in Egypt or Moldova or many countries, including India, or in also in private and public healthcare, where hospitals may be reusing syringes many times, not only because of affordability issues, but because of lack of education on the harms that can come from a reuse of a syringe, or just a simple convenience factor, or just lack of inventory management. But the end result is same, that the syringe is being reused. That leads to spread of infection. Patient stay in the hospital increases. You save a few pennies, and then you spend lakhs of rupees for that extra stay in the hospital bed, giving antibiotics, and the whole hospital is being overburdened. That's the problem, and that problem cannot be solved by WHO by itself. It cannot be solved by Ministry of Health by itself. It cannot be solved by the local district hospital by itself. If a manufacturer is making the technology solution by providing auto-disabled syringes or syringes with reuse prevention feature, the manufacturer also cannot solve the problem by itself. So each one becomes an interdependent, I would say interdependent player in the ecosystem, who has to jointly work as a team to address the solution. And that's where I would say the public-private partnership role comes into being over there. So safe injection is just one example. There are also other examples. This is an example that I can easily correlate with the HMD, because we had introduced that in India with the safe injection program, when the country moved from glass syringes to disposable syringes. And instead of using disposable syringes, straight away jumped onto auto-disabled syringes at the advisory of WHO. And we were asked to produce these kind of syringes in the country at HMD. And subsequently, when the program expanded from immunization, because immunization are only 10 to 20% of the injections, 80% of the injections in public healthcare are for therapeutic or curative purposes. The government wanted these kind of syringes to be available for use prevention in those settings where there was evidence of syringes being reused. So this is the kind of area where HMD has been working alongside various agencies. And then the other stakeholders who come into being. So you've got NGOs like PATH, like John Hopkins come into being, Gates Foundation, etc., both at the Indian level. And then again, the experience was taken forward at the international level. At the international level, this public healthcare partnership was taken over by the Clinton Foundation, and then by PEPFAR, the President Emergency Bill for fighting HIV/AIDS in USA. They created the global Making Medical Injection Safer program. HMD's Kojak syringes were presented to the US Congress. They were the only syringes of that kind available globally. And based on the availability of the syringes, the US government, along with this intervention strategy to fight HIV/AIDS globally, making medical injections safer, and safe injections was a key strategy as part of that global thrust to fight this scourge of HIV/AIDS. So unsafe sex, unsafe healthcare, unsafe injections were the different segments, and we were falling in the basket of unsafe injections. So in 13 countries globally, HMD had participated along with John Hopkins, along with PATH, along with John Snow, along with Harvard Medical College, and other various NGOs, and the local country governments over there, to introduce the technology and to educate the users about how to deploy the syringes in universal healthcare for every kind of injection in every curative setting. And apprehensions of whether syringes can be used for reconstitution of injections or not were allowed. And not only for public healthcare, the confidence then came to the governments in Tanzania, in Uganda, and Kenya, for example, Nigeria, that they completely banned the import of disposable syringes and made universal usage of these kind of syringes compulsory even in private healthcare for every kind of product. Now, with this kind of strong impetus of public-private partnership, the burden of HIV/AIDS came down drastically in these countries. The patient stay in the hospitals reduced. Uh, if we have time, I'll give you a quick anecdote of what happened in Tanzania. I was going around personally, and I was accompanied by somebody from the US Embassy, from UNAIDS, to a hospital in Tanzania. And while we were going around the hospital, a couple of nurses stopped me and asked me, "Are you here to give us some training?" I said, "Why?" She says, "Because I've joined recently and other nurses have got trained in the past, but not me." I said, "Why do you want to get trained? It's such a simple product. Why do you want to get trained?" She says, "Not about syringes, because when you people are giving the training, you're giving training not only about injection safety, but about the universal precautions for infection prevention." And I said, "What's been the impact for you?" So she pulled my shirt and she showed me a ward through a window. I just remarked to her, "Is it a new ward? Lot of empty beds." She says, "No, no. If you came by 1 year earlier, there were about 2 patients to a bed over here. Now it's empty." So I said, "Come on. Is that the impact of using the syringe?" She said, "Not only the syringe, but also the education that came along with the syringe." So now, before patient used to come to the hospital for 1 week to 2 weeks, they would stay on the hospital bed. Now you can see we've got empty beds over here because normally they go home in 2 or 3 days' time. So this is the end impact, what we're trying to achieve in terms of public-private partnerships. It's not about money, it's about the end goal. And that's what makes it impactful, and people like us get passionately drawn into that. And I think that's the kind of thing that has to go forward in terms of universal healthcare when we talk about affordability and accessibility. Because only then you can reduce the cost burden in accessibility in every country.
True. Thank you. Thank you, Mr. Rajiv Nath. The point you have raised is very, very important for strengthening the healthcare in India. The examples of syringe used repeatedly by the individual, especially in the case of HIV/AIDS. Yes, because I was the lead of HIV when I was associated with Ministry of Health, and this is the major cause why the HIV is spreading. But the example that you have taken, really everybody needs to just give more focus on proper and correct utilization of syringes. Thank you very much, sir. But from your insights, I have just recollected few things that need to be pay attention by all the stakeholders. The first is you call this healthcare sector is a red light, because there is lots of problem in healthcare sectors, but the stakeholders engagement, their commitment somewhere looks like zero. So this is red light until unless all the stakeholders have take their active part in solving the issues of healthcare. The second point that you have raised, healthcare problems cannot be solved alone by the government, by any healthcare organization, by the NGO. There is a need for a collective actions. They should come forward to take an active action to strengthen healthcare sectors. And a very innovative approach that helps to build the nation is public-private partnership, which is not very much active in the healthcare sectors. So all the sectors should just work on it if they want to strengthen healthcare sector. So thank you very much, sir. Very, very important points you have raised here. And I hope the participants who are listening here, the stakeholder who are listening to your insights, will definitely work on it. Thank you very much. Now I'll move to the other distinguished speakers and just have his insights to how we can just strengthen healthcare in India. We have Dr. Sandeep Mengi with us, Managing Director of Maharishi Dayanand Hospital, whose leadership exemplifies the role of hospital in delivering patient-centric care. Dr. Sandeep, how can partnership between hospitals, government, and private entities be leveraged to build capacity, especially in terms of workforce training and infrastructure development to achieve universal health coverage goal? Over to you, Dr. Sandeep. Over to you, Dr. Sandeep. Are you here?
Audible?
Oh, Dr. Sandeep, sorry.
Yeah, I'm audible.
Oh, yes, you are perfectly audible. Have you heard me?
Yeah, I've
Am I?
heard you. I'm on the topic. It is very right. Yeah, I, I'm audible to you.
Yes, yes, perfectly all right.
Yeah, as rightly said by my colleague, Dr. Rai, it most important part of healthcare.
Dr. Sandeep, can I just get back to you
So,
later because
talking
Dr.
about
Sandeep, your voice is breaking.
healthcare is an ignored sector actually by the government.
Dr. Sandeep, I just request you because your voice is breaking. Your voice is not very much clear. I'll just get back to you later once you settle down
Yeah, yeah, please,
somewhere.
please, please.
Yeah, I'll just get back to you better because there is some, I think,
Yeah, yeah, please
internet.
carry on with it. I'll be, yeah, right now I'm on I'm not on Wi-Fi. Yeah, please, you carry on. Please carry on.
Thank you, Dr. Sandeep. We'll just catch up later because now we have other, distinguished speakers with us. Now I'll just move to Dr. Silpa Tatake, Group CEO of Jupiter Hospital. She is a leader in healthcare management and operational excellence. We welcome you, ma'am, here, and thank you very much for your gracious presence. We want to know your insights because you are having a good experience of healthcare management in the Jupiter Hospital as well as others. So, ma'am, considering India's current progress towards universal health coverage, what role do multi-sector partnership play in accelerating this journey, and what key elements should be included in the future roadmap to achieve comprehensive healthcare across access for all? Over to you, Dr. Silpa.
Thank you, Dr. Singh. And thank you, Voice of Healthcare, for giving me this opportunity to interact with all the eminent speakers. I would say the healthcare, when we talk about universal coverage, as even Mr. Rajiv Nath had said, it is not a single player's duty or responsibility or a mandate. It has to have the collaboration amongst the sectors in the industry. Because as you see, which we all know, that private healthcare sector in India comprises nearly of 60 to 65% of total Indian healthcare infrastructure. We all know that it is when we talk about quality healthcare, unfortunately, as on today at least, private healthcare is an answer for Indian healthcare system. When we talk about universal coverage, basically we all know that access is the most important part of it. Second important part comes as a financial risk protection, and third is obviously quality. Now, for having the access, the cost of healthcare in India currently, most of us have to fund it out of pocket. Yes, there is a healthcare insurance which is getting penetrated, especially we are seeing the good number of people getting enrolled with Mediclaim is rising post-COVID. However, it is still not sufficing when we consider the cost of healthcare. When we talk about quality, quality also comes with cost. We cannot keep cutting corners at every stage. In my opinion, when we talk about private healthcare sector and the role and responsibility which as private healthcare providers we all have to follow is that we should ensure quality while delivering the healthcare. At the same time, healthcare or the access to healthcare cannot be only limited to privileged section of society. We cannot have the differentiation of socio-economic factor when it comes to it. So public-private partnership can be one of the good approach towards solving this particular issue. Of course, government is also taking crucial steps in enhancing the healthcare coverage, especially with Ayushman Bharat, the coverage of 5 lakh rupees for the family annually. That is one of the good steps. Government is also driving through NHA, National Health Mission, basically which gives access through Abha card for transparent healthcare and interoperability. At the same time, we all will have to collaborate for that because if you see today, awareness is not great. As a private the hospital, basically, we drive our patients also to register for ABHA. So that is one more approach. Second important thing is like that sooner we come on the digital platform through NHA and access, ensure interoperability, it will give fair and equitable healthcare nearly to all, because same patient can go to PHC today, same patient can go to rural hospital, or same patient can come to private healthcare sector. His health information can be accessed by all, and at the same time it will be easier and non-challenging aspect that we can deliver the seamless care. So that is one good part of it. It is basically on us how fast we can go on that drive. And most of the private hospitals are still to get enrolled with it. Few hospitals have already done, which are basically at national level chains, and few are still getting enrolled. So that is another thing. So access basically when it comes to private healthcare is not a major issue, but it is still a kind of challenge when it comes to underprivileged part of the society. There are commercial and as well as there are charitable hospitals where again they have the provisions of having patients or having beds reserved for the underprivileged class. We also consider, as for example, as Jupiter, we do have our CSR initiative where we support that. We support underprivileged class of society by offering nearly 35 to 40% subsidized healthcare, same quality healthcare. Another aspect what we can undertake is like through healthcare education. We can train the trainers. We can actually have the telemedicine, community medicine getting practice. Our expert clinicians can actually develop across rural or the remote areas. We can actually handhold the doctors. There can be a concept of rural or a remote ICU structure. So these are the ways and means by which we can actually support this accessible healthcare and quality healthcare towards the country. That is one thing. Another important part which I particularly feel is like healthcare financing when we talk. There are several schemes like Rashtriya Bal Swasthya Suraksha Yojana, there is Ayushman Bharat, then there is also support through state governments because health is typically a state subject. So there is a CM fund, there are other statewide different schemes. So at the same time, it has to be pragmatic. When we consider Ayushman, still there are private hospitals or corporate chains which are reluctant to enroll. The very reason is that the rates which got finalized are unrealistic. It is very natural and easy to say that healthcare has to be accessible at affordable. But when we talk about sustainability and scalability also has to be considered. Otherwise, what happens? It becomes an eyewash. The hospitals, for the sake of they take the scheme, they enroll themselves on paper. But while actually the patient comes, and when we know that economic burden is going to be high and the recovery of the funding or recovery of the charges is going to be tedious from the government side, then there is natural tendency of avoiding such patients. So instead of just eyewash, I think more importantly, we should focus at the grassroots level. The challenges are faced, ensuring that there is no corruption at that level, and rates have to be respectable. Government actually was to frame a panel wherein there are going to be accreditation standards based on the service delivery standards offered by hospital and infrastructure. I think that has to come in picture fast. Then only it will become possible to offer the care, enroll under those schemes, and march towards universal health coverage. That is what is my input for the same. Thank you.
Thank you very much, ma'am, for your wonderful insights and thank you very much, ma'am, for your wonderful insight, because you have explained the picture of the healthcare schemes that is being provided to the underprivileged section and other section, not in the urban or semi-urban area, but also in the rural India. And I'm having an experience of a few patients. Those are just accessing quality service to the Ayushman Bharat. And definitely not only the government but private sector are also playing very, very important role to get the underprivileged section associated or linked with these healthcare schemes, and they are getting benefited of it. And one major point, and you have highlighted that for a good healthcare to all, we have to be focused on ensuring accessibility, affordability, and sustainability of healthcare services. And for this, not only the government, but also other sectors should come forward. They should, start working together to benefit entire community, especially the underprivileged section, to access good quality healthcare. Thank you very much, ma'am, for your wonderful insights. We'll discuss more further. Now I'll move to the other, experts. We have with us Mr. Harshit Jain, General Manager of Business Development at Panacea Biotech, with a wealth of experience in pharmaceutical innovation and public health. Thank you very much, sir, for joining us. Mr. Harshit, given Panacea Biotech expertise in vaccines, how can partnership with government and NGOs enhance the reach and impact of vaccination program critical to achieving universal health coverage goals? Over to you, Mr. Harshit.
Hi, thank you everyone, and thank you for hosting this panel. It has been a very interesting panel so far. So as Panacea Biotech and governments, vaccination is a very sensitive topic in majority of the circles, and majority of the vaccines that are so distributed globally are either donated or they are through the national immunization program where the government buys. For example, in India, almost government buys for 24.5 million children every year that are immunized by government of India through the national immunization program called Indradhanush. So now even many of the vaccine manufacturers have received funding from different NGOs to develop new vaccine interventions, or they get investments for new technologies like micro needle patch to increase so that they can government immunization programs are more efficient, more productive, and reach a vast variety of users. Sometimes you have people who have vaccine hesitance just because of a needle. So NGOs come in that picture. They invest in vaccine manufacturers and medical technology companies to develop micro needle patches and get them to market. Similarly, they also work to identify other challenges that people might have and have vaccine hesitancy. Sometimes they are about side effects. Sometimes it's just about reach and accessibility. Our country, India, is very vast and very difficult to reach areas. And many of the African countries and Asian countries are similar. And to reach every child, NGOs at times provide the last mile delivery to actually reach the farthest most corners of India and many other countries. Apart from this, NGOs are also there in policy making to enable better formulation of policy, which is more equitable. For example, we now have an African vaccine manufacturing accelerator, which has been funded by more than $1 billion, with the sole objective of bringing industry and vaccine manufacturers to Africa. Similarly, you have other NGOs that work just to provide services to the people at lower cost or at affordable pricing. And overall, they also help in terms of supply chain efficiency, maybe more environmental sustainability of the supply chain, of the cold storage, of reducing plastic waste. So they also have these other ambitions beyond just healthcare services, but also ensuring that they are done at a low carbon footprint. Apart from this, they also help. One of the key stakeholders is adoption of vaccines. So whenever new vaccines, for example, our hexavalent vaccine was to be adopted by governments across the world, NGOs help us to facilitate that by undertaking additional trials in the field to understand how these new vaccines behave in the field and what the government immunization program needs to accommodate for. So these are in short, multiple areas where NGOs and private companies continue to innovate with the government and have been and are an integral part of the entire ecosystem.
Thank you. Thank you very much, Mr. Harshit. You have talked about the vaccination immunization program of government of India, and you rightly said that government immunization and vaccination program is very, very effective and very, very, perfect. Government is putting up its proper efforts, but beside these, the NGOs, those are playing very important role to help the government to making this immunization and vaccination program a great success here. So we can't ignore the role of NGOs in making healthcare sectors more robust. more accessible to all. And your suggestion and recommendation that especially for the good vaccination, proper vaccination to all the population or the generation, the government should come up with a better formulation of the policies, and each healthcare sector should ensure there should be a low carbon footprint, so that the healthcare sector should not generate more carbon, and we can just ensure the environmental friendly healthcare system in India. Thank you very much, Mr. Harshit. So now I'll just come back to the expert again, Mr. Rajiv Nath. Sir, thank you very much for your insight that you have given earlier. Now, we want to know your insight also on considering your leadership in the medical devices sectors. How can domestic manufacturing be leveraged through partnership to support universal health coverage goals in India? Over to you, sir.
Historically in India, I would say it has been pull-driven in most cases, and in some cases push-driven. So in pull-driven, like for example, when vaccination was initially introduced in the country, the biggest challenge was setting up cold chain supplies and storage for the vaccines. And the equipment was coming in from overseas. So UNICEF, WHO, and Government of India reached out to manufacturers like Voltas and Godrej, Blue Star, and urged them to produce refrigerators and equipment for cold storage of these vaccines. Because being a public healthcare product, this was not something they were making. And the kind of fridges and the storage they were making were mainly for consumer goods and for retail shop and outlets over there. So this is the kind of, I would say, vendor development approach, where first you need to have suppliers available in the country to fulfill your public healthcare needs, then allow them to make to a uniformly defined specification, or a WHO defined specification, or an ISO defined specification or standard, and then you allow at the next stage healthy competition to set in by having more number of suppliers coming into the supply chain over there. But this is quite typical. So whether it's been the Stop TB campaign, or the fighting the HIV/AIDS campaign, or fighting hepatitis campaign, these are the kind of, I would say, public healthcare partnerships which have been coming into play, where it has been pull-driven from the department, DGHS, or the Ministry of Health, to manufacturers. In COVID times, you saw it in terms of things like PPE kits or diagnostics, where even for ventilators, where the government came forward and gave target pricing, that this price is what we're going to be buying at, and this price is going to be profitable for you to manufacture at. So it was not the L1 lowest price tendering, which has been historically in the past. This kind of approach allowed manufacturers who were not even from the medical device line, even from automobile manufacturing line or the auto parts manufacturing line, to step into making medical devices during lockdown and try to attempt to make medical devices which were critically required for fighting the scourge of COVID over there at that time. This is the kind of, I would say, Make in India initiatives which were very well driven. However, they have to be sustained. So it was unfortunate, like for example, 30, 40 factories were put up for making oximeters, around 20, 30 factories came up to make thermometers, more than 400 factories came up to make PPE coveralls, more than 600 factories came up to make masks. And after 2 years time period, you have only not even 10% of those companies surviving and continuing to make the product. The other people have just died down, or they left the manufacturing, and that was a wasted capital expenditure from their side, and a noble cause which left them disappointed finally. So what would have been nicer to have been seen is to have continuity and sustainable supplies from the manufacturers for a possible pandemic in the future, by creating a stockpile and by replenishing the stockpile going forward through the public healthcare system. Because in any case, these kinds of products are required in usage for every hospital or every public healthcare facility or a private healthcare facility going forward. So one can always draw from the centralized stockpile and keep on replenishing it on a yearly basis. Or alternatively, they could have been supported by having a coordinated overseas external, I would say, marketing campaign, whereby when we are claiming to say that we've become now the second largest PPE overall manufacturer globally, those manufacturers could have been helped to get the regulatory approval so that they could continue to export internationally and access those markets which are typically challenging to enter because of regulatory approvals and controls required over there, especially for manufacturers who have not got prior experience to make medical devices. So this is something I would say as a learning going forward, where we need to work in terms of partnership, and the government needs to be a fair buyer, because moving from the target price approach within 1 year's time to having an approach of again L1 pricing, reducing custom duties to 0%, uh, allowed overseas material to be dumped into the country, and these 90% of these manufacturers die out. So I think as a Make in India initiative, as a manufacturing initiative in terms of partnership, one needs to be ensuring that this to be a sustainable procurement and sustainable supplies over there. Both manufacturers need to be competitive, and government being the biggest buyer needs to make it a sustainable effort over there. It has to be win-win for all, and not just only when a friend in need, in times of need, that you find that you're opening the doorway and later on you're closing the doorway. Those are my thoughts.
Thank you, Mr. Rajiv Nath, fantastic, because you are expert in medical devices, and the challenges that you have explained, how as a leader of the leader and manufacturer of medical devices, of course there is a challenge, and lots of challenges are there. But you also shared the solution for it. If supply chain is available to fulfill the demand of the people of the public, but buyers should also be available. And you generally talk about, for this, a robust and sustainable partnership is required, not only from the private sector side but also from the government side. Government should just give proper support to the medical device manufacturers so that they can help and fulfill the demands of the healthcare systems. And so what I just got from your these insights, that the success of universal health coverage depends upon our collaborative action, commitment, and innovation. If we just focus on these three major elements, the vertical, definitely medical device manufacturing kind of industry can be promoted. Those can ultimately support in strengthening healthcare in India. So thank you very much, sir, for your great insights on this. Now I'll just move back to our speaker, Mr. Sandeep Mengi. I think he's available now. He's a managing director of Maharishi Dayanand Hospital, and his leadership exemplifies the role of hospital in delivering patient-centric care. So I just welcome you, Dr. Sandeep. You are here.
Yeah, I'm here only.
Oh, thank you very much. So, Dr. Sandeep, just considering your great experience in working with the hospital, in managing hospitals, especially in patient-centric care. So how can partnership between hospitals, government, and private entities be leveraged to build capacity, especially in terms of workforce training and infrastructure development to achieve universal health coverage goal? Over to you, Dr. Sandeep.
Yeah, yeah. Thank you very much for calling me on this panel. And as rightly said, all by all my colleagues, that it is the collective efforts and collective responsibility of everyone to make universal healthcare possible in India. It is not only the responsibility of a government or a private hospital. It is the responsibility of government, private hospital, and public also. I mean, civil society. Because private healthcare is already 70% of the load has been taken care by private hospitals. Government has played its role by giving the Ayushman Bharat 5 lakh rupee each. In my state, if I talk about it, is for everyone. We face challenges also, but still we are doing it because it is a government scheme and it is a good scheme, because healthcare is that important part of life which everybody needs, and it should go to everyone. Talking about civil society need to play more role into it, because civil society is that part, because they can educate the rural as well as urban, both in terms of giving them the education that the scheme is available, you can have a good healthcare and all those things. Like you all know about it. Talking about other things in healthcare, healthcare is already facing a lot of challenges, like uh, the payment issues and all those things which our state are facing right now in Ayushman. We have not received the payment from last 9 months, what we have done in Ayushman. So these are the challenges we are facing in healthcare. Leaving aside the challenges right now, the topic is little different. It is a universal healthcare topic. So I just keep be on that topic only, because healthcare is a very, very, very important part of human life, and it should be to everyone. Uh, in terms of giving the good healthcare, hospital is already doing it good. I mean, 70% of the load has been taken care by the hospitals and private. Government has Ayushman Bharat, but still there is a scope of giving more, because the government has already promised for 7 lakhs. This is a welcome step by the government, and yes, this is a welcome step by the government, and let's see how much we as a private players and the civil society played its role in giving the knowledge and the inputs of the government schemes to the public. Thank you very much.
Thank you, Dr. Sandeep. Uh, you have, rightly said that collective action is something that can help in ensuring proper and quality healthcare in India. You have rightly said that government is playing its role, but definitely the civil society organization are playing very, very important role, especially in educating people, not only in urban, semi-urban, but the rural areas of the India. And the healthcare is very, very important of our life. This is fact that if we are not healthy, we can't expect anything else that we can achieve in life. So healthcare is a very, very important agenda for every individual. And the healthcare scheme you talked about, Ayushman Bharat. Day before, yes, I think on 9th December, I have a big event in Mumbai, especially on the observance of International Anti-Corruption Day, where we had more than 40 healthcare providers. And the agenda was just to focus on health governance. We found that definitely Ayushman Bharat is doing lots of things, but somewhere there is a lack of proper monitoring and tracking of the beneficiaries, how they are just getting benefited, how they are accessing these services. But definitely Ayushman Bharat is doing well, and creating more awareness about the healthcare schemes among the public is still required. Thank you very much, Dr. Sandeep. So
Thank you very much.
now I'll just move to our other experts, Dr. Silpa Sake. So, Doctor, uh, actually, your experience in healthcare and the insights as you have already shared in your previous turn. Now, I would like to know from your side, how can multi-sector collaboration help hospitals integrate advanced technologies such as telemedicine and AI to improve accessibility and efficiency in healthcare delivery? Over to you, Dr. Silpa.
Yeah, thanks, Dr. Somnath. So, as I mentioned previously, also that multi-sectoral collaboration is no more a choice. It is basically a crucial factor if we really want to move ahead for UHC. When it comes to telemedicine and AI, post COVID, luckily it did act also as a boom because healthcare otherwise wouldn't have embraced technology so fast, which COVID compelled us to do. And telemedicine actually had taken a front desk role at the time of COVID, and we actually widely used it left, right, center. That had actually fueled technology in healthcare in a major way. So currently, as I have said, there are many remote ICU which are actually coming in picture. Corporate hospitals are supporting ICUs in rural areas by handholding them, by monitoring it live. Also, same time, telemedicine, though it is still not prevalent as what we had expected post-COVID, but it is still getting adopted and accepted by majority. That is another thing. With AI again coming in picture, it will actually act as a boon. for accessibility and for universal health coverage, because with AI, it becomes quite easy to monitor the vitals, healthcare parameters, even remotely. Today, my intensivist can access the parameters of a critically ill patient of ICU, even sitting at home or while traveling. Accordingly, they can actually have the live guidance given to the people on floor. So that has played a really crucial role, and I'm sure it will improve further. That is not the only thing. As you are aware that wearables industry is also really enhancing in terms of market share. There are lots of wearable devices which are coming, which will monitor vital healthcare parameters, for example, heartbeat, ECG, or even your heart rate, your respiratory rate, and can give warning signs. Apple Watch is something which we all are aware of, but there are other wearables devices are also coming in picture. Apart from that, wearable industry, we have now the home care, which is also setting its footprint in healthcare. Um, Again, post COVID, it has had its own challenges, but it also had the privileges, because people have started preferring care at their comfort at home. Home care will also actually be helpful because we are developing actually workers, healthcare workers on foot, soldiers, soldiers on foot. So there are people who can approach at doorstep and can take the treatment, can then be directed to the hospitals or secondary healthcare centers if the alarm signs are there. So at least the primary level guidance which Bohr committee has envisaged in 1946 by creating PHCs, today's home healthcare can partly take that role if it is governed properly. So now the new initiatives which we are actually having, like there are multiple home care companies are getting emerged, but we lack the governance. So we require a robust framework and the governing structure, which will actually help to ensure that the quality healthcare is delivered at the doorstep. So I would also suggest that PHCs or primary healthcare centers, which initially we all used to have, and currently also it is converted in the health and wellness centers at remote levels. Those required to be further strengthened. And again, here private hospitals can play a role. We can ensure that our expert team of doctors can visit those particular centers, maybe at frequent intervals, at decided intervals, can ensure that we also play our social responsibility and contribute from our side for that. So all these measures together can support a multi-sectoral partnership. Of course, insurance will have to play a role, that pharmaceutical companies will have to play a role, because nothing happens only one-sided. Say suppose tomorrow I say that I will offer the particular service at a subsidized rate, when nearly 40% of my service delivery comes from materials, from consumables and from medicine. I alone cannot take care of offering it at a affordable rate. So whole industry will have to go hand in hand to help the underprivileged section. Again, insurance, because with Ayushman Bharat, yes, the penetration is increasing, but still awareness is to be improved further. So there have to be camps and campaigns undertaken wherein, along with the lay person of the community, even the healthcare providers, the smaller healthcare providers also are getting encouraged and aware of all these schemes. So I think these are the ways ahead to ensure that by 2030 we reach our milestone and destination. Thanks.
Thank you very much, Dr. Silpa. Fantastically, you have just said the existing challenges in the healthcare sector, as well as the solution you have already talked about, and you also shared the status of the telemedicine initiatives that is being preferred by not only the healthcare providers but also the healthcare seekers. And of course, telemedicine is not so popular in India so far, but it is now getting the benefit or attention of both the healthcare providers and healthcare seeker. And at the point of AI, your point is very much valid. Definitely, AI can be used to strengthen the data management side of healthcare, whether it is patient data, whether it is service providers data, and whether it is this as healthcare research. So definitely, the healthcare providers should be AI friendly, and they can integrate such kind of services into their systems. And in the healthcare, you just talked about healthcare integrity. So you talked about the proper governance structure, you talked about the ethical practices, you talked about the transparency, you talked about the accountability. Definitely, ma'am, because until unless we ensure the integrity, proper integrity in the healthcare sectors, which comprise all these four major elements, we can't ensure a robust healthcare system in India. So all the healthcare providers, the government, the private sectors who are very much engaged to work on the healthcare issues, they should just ensure the proper integrity in their healthcare system. So now I'll just move to our third, speakers, Mr. Harsid Jain. Mr. Harsid, welcome again. I'm just coming to you to know your insights on some innovative models. So, what innovative models of collaboration do you foresee in the pharmaceutical sector that can accelerate India's progress towards achieving universal health coverage day? Mr. Harsid, I would like to mention here before you start answering this question that pharmaceutical is something that playing very, very important role in strengthening healthcare sectors. If pharmaceutical and other healthcare organizations come together, definitely lots of challenges in healthcare sectors can be addressed. So considering all these things, I would request you to please respond the question that I have just put up to you. Over to you, Mr.
I
Hassan.
think this is a very interesting question. And we have seen many countries in Latin America have very high rates of health coverage. Everything is covered by the government. In India too, we have everything, already there in our government decision making. The only challenge that we're having is capacity. Our
Mhm.
government healthcare system is too overburdened, but they do provide many services free of cost. Similarly, Ayushman Bharat is there, which is also, not able to catch up to the pricing in the private market, but is still able to provide, near universal coverage across a range of issues. We also have the vaccination programs that are provided for free. So in India, the challenge is people have to spend out of pocket because of capacity constraints and having to go to the private sector because of lack of capacity or expertise. So in general, we have the framework for it. What we need to do is now put more money on it. You really need to improve the percentage of GDP that is spent as part of healthcare to ensure that people get good infrastructure and facilities. We're already the world leader in medical tourism. I think every patient who flies into India probably cross subsidizes a few Indian patients also getting very affordable healthcare. Now, we always see that in the metros, the cost of healthcare has gone up tremendously. Whereas in rural areas, healthcare access is a problem. So I think we are seeing two sides, extreme, that needs to be. The middle is the government has to come in the middle and really push for more affordable access. On top of that, I think cost of healthcare in terms of drugs is also very important. In the US, we have seen some new experiments in which manufacturers are charging just 10-15% margin over the cost of their raw materials, which is also very innovative model to get more affordable, medicines that are high quality and to the general public. I think this also would go a long way. And in India, we have seen Dava India and other stores that are coming up who are operating at such models, but quality is something that has to catch up. So I think we have this. We have the basic infrastructure available, the thought process, the law. Now it's just about spending more money. Thank you.
Thank you, Mr. Harsit. I think very important point you have raised here to strengthen collaboration. One is the affordable access to healthcare. If different stakeholders are just collaborating for the cause of healthcare, so first of all, they should just give focus on affordable access to the healthcare, which should be affordable to all. And second one is drugs availability to all, because irrespective of their cost and anything, government should make provision, and pharmaceutical sector and other healthcare organizations should make provision so that the drugs should be available to all category of the people in the country. Thank you very much, Mr. Arsid, because now we are running short of time, and Mr. Rajiv Nath has already mentioned that don't go beyond the time limit. So only one common question I have to all the distinguished speakers. Considering your experience, vast experience in healthcare, so I would like to, from your side, one suggestion and recommendation to enhance multi-sector collective action to strengthen healthcare sector in India. We start from most experienced person, Mr. Rajiv. Sir, over to you.
Thank you, Dr. Somnath. I think the most important point is very simply healthy communication and empathy. Like was very clearly mentioned by Dr. Shilpa, hospitals need to provide healthcare and not at a loss. Similarly, manufacturing has to be done, but not at a loss. There has to be some reasonable and rationalization in terms of procurement and in terms of compensation and in terms of timely payments. So, if the government wants affordable, reasonable healthcare delivery to be done by partnering with the private hospitals and by partnering with manufacturers for supplies, they must ensure that the procurement terms of tenders should be honored and payments should be made on time. Only then manufacturers and hospitals will come forward and share the burden. Otherwise, they will shy away and escape from the burden. Thank you.
Thank you very much, sir, for your insights and the recommendation to improve healthcare sector in India. Now, I'll just move to the other speaker, Dr. Sandeep Mengi. What is your view and recommendation for improving
It
healthcare
is
sector?
it is rightly said by my colleague Dr. Shilpa and Mr. Rajiv that affordable healthcare is necessity right now, but the thing is that it should be win-win situation for everyone. Hospitals are providing healthcare, but the government has to take care of the hospitals also. Giving the healthcare at a very economical rate, at reasonable rates, it's okay, but it is for not good for the hospital health. Hospital should have at least that much profit wherein the expenditure of in different sectors which hospital has to bear, that has come out of it. Giving government has to come up with some panels, some more UK collaboration with the private hospital wherein they can go in talks to them and they can have their at least have their rates wherein the hospital should have a win-win position in let's say same manner. I mean, government should come up with this. This is my suggestion.
Thank you, Dr. Sandeep. Now I'll move to Dr. Shilpa. Yeah, Dr. Shilpa,
Yeah,
over to you.
yeah, hi. So, only recommendation basically, we all need to be pragmatic. Sectors across India, and because we are talking about currently India to reach over there, have to collaborate with each other seamlessly. And more importantly, I think the awareness at a community level. Unfortunately, when we see that government is actually propagating all these measures, but hardly, I would say around 30-40% of the section of the community is aware of it. If you talk today of your maids and servants, they are not probably aware that these kind of schemes are there for their future and their protection of their health. So we all need to take that ownership as a responsible citizen along with the healthcare provider. That is what is my recommendation. Thank you.
Thank you very much, ma'am. I'll just put a highlight on your topic that healthcare systems should have proper governance structure, ethical practices, and proper transparency to improve healthcare sector in India. Thank you very much, ma'am. And now I'm just moving to the last speaker, Mr. Harshit Jain. What is your recommendation and suggestion to improve the healthcare?
I think I echo with the rest of the panelists. I think they've very comprehensively covered every aspect, and I agree with all of their comments, including Dr. Shilpa, where we need to focus more on communication of our existing policy framework and options that are available to the general public. Thank you.
Thank you very much. Thank you very much. And on behalf of Voice of Healthcare and UN Global Compact Network India, I just express my gratitude for your gracious presence and insightful discussion at this third edition of Universal Health Coverage Day. So thank you very much, everyone. Now over to Mr. Ravindra for final.
So thank you, Dr. Somnath, for moderating this insightful session and guiding the discussion so effectively. We would also like to thank our esteemed panelists for sharing their invaluable insight and experiences on the role of multi-sectoral partnership in achieving universal health coverage. We are grateful for your time and contribution to this important dialogue. Thank you once again all.
Thank you. Thank you.
Thank you.